I, the double.
For sure. I'm going without him. It's not nice.
Test. I'll do that gently so I don't break anyone's ears. Okay, I think we're going to go ahead and get started with the meeting.
Hello.
Okay, they are trying at this time to dial in with Commissioner Friend, who is, I assume, out of town. And so are we all set now? Can we hear him?
Yes.
Okay, so we're good? Okay. I'm sorry I couldn't.
Try to talk to Rodney.
Well, I haven't called the meeting to order yet, so I can't
yeah,
really
that's
do
true.
that. At this time, I'd like to call to order the meeting of the Lynn Haven City Commission. It's Tuesday, August the 29th. This is a special meeting, really for actually 2 items. We're glad to see so many of you here today, and thank you for being here. Before I begin with item number 2, the invocation and the Pledge of Allegiance, I would like to just check and make sure that Commissioner Friend is able to hear the proceedings. Commissioner Friend, can you hear me okay? Commissioner Friend, can you hear me okay? Okay, I'm going to take that as a negative and go ahead and proceed with the meeting, and then if you're able to connect Mr. Friend or Commissioner Friend at any time, we'll be happy to interrupt and move that he be accepted to participate in the meeting by telephone. So we'll just put that off for a moment if that's okay with everyone. At this time, I would like to call on my good friend, Mr. Leon Miller, who will be leading us in our invocation. Thank you, Mr. Miller. Would you please stand?
At this time, like,
Thank you. You touched us this morning and started us on our way over.
we are gathered.
And Heavenly Father, we want to ask you to make a special blessing up under these citizens. Spend the time to come to today's meeting, oh Heavenly Father. We hope that the decisions out of this meeting were better than Lynn Haven, oh Heavenly Father. Oh Heavenly Father, we ask you a special prayer for the people of Houston, oh Heavenly Father. And as we visit those this afternoon, oh Heavenly Father, we hope that you put in our hearts that we will reach out and give them some kind of help from Panama City, Florida, and Lynn Haven. Thank you, oh Heavenly Father. In thy name, for Christ's sake, amen.
Pledge of allegiance.
Hello.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you so much. And before we get started, I would just like to echo Mr. Miller's thoughts about the people of Texas. We've all been through our share of storms and water and flooding here in our area. And if you're like me and you lived here in 1995 when we had our last catastrophic storm, which was Hurricane Opal, we experienced catastrophic flooding. And I have to say that the first sounds I heard the morning after the floodwaters receded were the sounds of both Salvation Army and Red Cross trucks going through our neighborhood, offering hot meals. City employees were out all night in boats and helping people. And it was a horrific night. And then just 2 days later, one of our Lynn Haven churches, the pastor knocked on the door and had a basket, literally a basket on his arm with $100 and $500 checks written with blanks for people to fill in, handing out to people trying to help. So please be generous. It could be us as easily as it is them, and there are many different ways to give. And at this time, if I could get a motion from someone on the commission to approve Commissioner Friend's participation either by phone, and if that doesn't work out, to approve his absence from the meeting. If you could make it a double-edged sword of a motion, that'll take care of all of it.
Move approval.
Thank you. There's been a motion and an approval, a second rather. Mr. White, would you please call the roll for
Commissioner Barnes? Aye. Commissioner Russell? Commissioner Tender?
Yes.
Mayor Anderson?
Yes, and so either by phone or by absence, we have approved Commissioner Friend's participation or lack of. And Commissioner Friend, if at any time you can hear us and you want to jump in, please feel free to do so. Okay, moving on to item number 3. This is approval to change the City Commission meeting from Tuesday, September the 12th, which is our normal scheduled meeting at 4 p.m., to Monday, September the 11th, 2017 at 5:01 p.m. Preceding the commission meeting will be a 3:30 p.m. Fiscal year 17-18 budget workshop, and then a CRA meeting at 4:30. So a very busy afternoon. The reason for the change in time is that other agencies within Bay County are having to have their budget meetings to make sure that we all get in before the closing date of the state statute, and so therefore we're having to have ours on Monday at 5:01. So please mark your calendars and plan to be here. Is there a motion to approve?
So moved.
Second.
So there's been a motion and a second. Any questions from the board about this? Any questions from the public? Okay, Mr. White, would you please call the roll for approval?
Commissioner Barnes? Aye. Commissioner Russell?
Aye.
Commissioner Friend? Commissioner Tender? Yes. Mayor Anderson?
Yes, and so the motion stands approved. And then item number 4 is discussion and action to approve the new insurance brokers' group insurance plans and rates for employer-employee contribution levels. At our last commission meeting, there was a report brought to the commission regarding the sealed bid for the RFQs, which went out for the insurance proposals, and it was recommended to the commission that we accept a Ventrust insurance company, and there was approval by the commission, and then there has been movement forward in that direction since by the city manager. So at this time, I would like to turn over this portion of the meeting to our city manager, Mr. White, and to representatives from Aventra, and then at the conclusion of their presentation, if there are questions from the board, questions from the public, questions from other agencies, it'll be an open discussion before the commission votes for approval. Okay, this time?
Thank you, Mayor. As you all may know and remember, we was being pressed a little bit for time, but one of the things that I looked at as soon as I got here was insurance. One of the first things a lot of the employees that's in the audience that recommended to me that I need to look at the insurance, and after looking at the pricing and looking at the way it's put together, I think there was a need for more services. So that's the reason we done the RFQ, and y'all approved last meeting Ventrust as the provider based on the services they offer, and them being able to meet the real deadline that we have, and we are on a timetable. So at this time, I'd like to ask Owen Wingate from Ventrust to step up, and each of you have a packet, and he's going to go through a lot of highlights. I encourage you to ask him questions. I also will be interjecting throughout the presentation to try to let you know where we're at currently versus this new, and that way maybe fill in some of the gaps. This time, Owen.
Thank you very much. Can you all hear me? I'll use my outside voice. Thank you guys for a vote of trust. And my brother Weston Wingate here and I own Ventrust, and Ventrust is actually an acronym for A Benefit Administrator. So in addition to being just a regular insurance broker, we're actually a full-service benefit administrator. So we'll go through the presentation. I have it up here on the PowerPoint. It's going to be very hard for the people in the back to see unless they have laser-like focus. But y'all have this in front of you, and what you're looking at here is page 1. And I'll just briefly hit some of the highlights, but some of the services that we have proposed that we provide for you these are all services that are at no cost to the city. Okay, we get paid a compensation for handling your account, and we pay for these services for you. So your annual benefit plan marketing, we'll be marketing the plan to other insurance carriers. We have an online enrollment system of Ventrust Access that we will give you guys, and everybody in the company will be able to access their benefits online 24 hours a day, 7 days a week. We did not build the Ventrust Access system ourselves. We actually access it from another vendor. There's 27 million people on the platform, so basically Google, Under Armour, some of the big companies that are on that. We're going to provide your full service COBRA administration. It's actually integrated into the platform, so some of the stuff's just administrative that's going to take off the work of the staff. Open enrollment support, we have a full team that's going to come in and help do open enrollment. Benefit reporting 1094, 1095, you're something with the ACA that you had to do with the reporting last year. We're going to do your reporting for you as we move forward. We do monthly premium reconciliation, where we actually send you guys one consolidated premium every month. Y'all send us one check, and then we pay all the different vendors, so that you're not having to reconcile multiple bills, which is very efficient, saves time, saves money. Billy is our monthly consolidated premium invoicing. Claim advocacy, if somebody has a problem, the employees call us. We want them to call us, and we will help them through their claim problems that they're having. So anytime that there's an issue, they're going to call a Ventress. We have an assigned account coordinator. We'll go through this with you guys as well. Y'all don't have to worry about 5500 preparation. And we do CMS filings, which is the Center for Medicare Services. You have to do 2 times a year, and we'll do that for you. So that's just kind of a brief, very fast overview of some of the services that we do. We also do lots of stuff that's in this book, so I won't spend a lot of time on it, but we're going to go over medical insurance, dental insurance, vision insurance, health reimbursement accounts. This is going to be like drinking through a fire hose for a few minutes, so if y'all bear with me and please ask questions as we go, okay? Let's go ahead and go to page 3. Moving right along here, okay? So one of the things that we do is help keep you compliant. Because we are administering the benefits, we're working on compliance. Because y'all have over 50 full-time employees, you have to be compliant. Premium affordability is one of those. Y'all actually fail that test today. If we go through it, the employees cannot spend more than 9.69% of their income on the health insurance. Currently, you guys, that for your number, that is, they can't spend more than $1,962 a year. You're at $2,140 a year. So basically, you fail the test. The fine for the test, if some of the employees were to get a subsidy from the government because it's cheaper for them, would basically be $2,260 an employee minus the first 30 folks. So about $275,000 for the group. So we think that's kind of important that we address that. The out-of-pocket maximums under healthcare reform cannot exceed $7,150. Y'all are fine there, or $14,300 for a family, so you're good there. Summary benefit coverages are provided by Florida Blue, and you guys are providing those to the employees, so you're fine there. Exchange notice distributions, we've discovered that we need to be doing a little better job on that, so we're going to help you guys through that a little bit. And then the waiting period cannot exceed 90 calendar days, and your first of the month fall in 30 days, so you're fine. Okay. A little bit about our company. West and I own the company and come up with the planning here. Ashley is going to be y'all's assigned account coordinator. Jenny, we have one person that's assigned to you guys for actual compliance to make sure everything's right. She does all the paperwork and everything. And then we have a billing department that takes care of all the bills. So, some of the things to think about as we move forward, as Mr. White was telling us, we were charged with getting better benefits for the employees. So we're thinking about that as we move forward. Flexible spending accounts is something that you guys do not currently have that y'all could offer to the employees. And basically that allows them to pre-tax some money that they pay for their deductibles and co-insurance and co-pays. They can put it away, take it out of their check, put it into an account. They can use a debit card to access those funds and pay for any of their out-of-pocket expenses.
Could I add to that? A little bit of this, Commission, is a lot of times it's hard for people to come out some money out of their pocket. Some of the employees come out of their pocket with co-pays or some of their deductibles. So they'll be able to payroll deduct prior to taxing up to, is it $2,600?
$2,600.
Up to $2,600 that they can put in that account, and they'll be given basically a Visa card. So if they go get their medicine, they can use it then. If they go to the doctor, co-pay, they can use it there. And it allows them to help manage their budget a lot more.
Basically what happens, and it's a very good description of it, what happens is if you put $100 a pay period, you'll get paid 24 times a year. If you put $100 a pay period into the flexible spending account, that money becomes available to you on the first day of the plan year. So the whole $2,400. So if you have a high deductible, you have high expenses. If you go out of pocket, that allows you to use that to help pay for that. So if you're a chronic user of the plan, and one of the things that we're going to talk about as we move forward here in a little bit, I've got some claims information here, so you can see y'all have people that are chronic users. That's what the plan's for, is to help those people pay for their medical expenses. But you have a whole bunch of people that are not using the plan that way, and so we want to help both people, okay? So we'll kind of go through that. So something to think about as we move forward is the flexible spending account. I put a little presentation in here for you to see. There's a charge for the administration on the flexible spending account. They charge Discovery benefits. We actually use an outside administrator. It's a straight cost. It's $4.85 per employee per month that takes the plan. We don't pay anything for anybody if they don't take it. The city actually, for whatever money the employees contribute to the plan, the city doesn't have to match Social Security taxes or FICA taxes on those employees. So you save at least 7.65% of every dollar that the employees contribute, you're saving. So it kind of offsets the cost of the administration of the plan. So just food for thought. There's a little bit. Wes, would you?
So one of my thoughts is there, I would like for y'all to consider, the first thing would be, the city picking up the cost for administration for this, because we are saving money on the backside as far as Social Security taxes, but it'll give the employees an opportunity to prepare for sickness and illness that may occur in their family.
So this is $4.85 per month?
Per employee that participates per month.
Okay,
Yes,
per
sir.
employee.
So if they contribute $100, they're saving $7.65 in taxes. Well, they're saving more than that. You guys are saving $7.65 in taxes. The way your plans are set up, you can see in here, they show an example of 150 employees and that 22 people participate. Not tons of people participate in these programs. There are some rules, which our staff would go through the rules. If you don't use the money by the end of the year, you could lose the money. So we don't want you to over budget. We want you to under budget. But our staff's very familiar with how to enroll this and how to help the people figure out what their budgets are based on their own claim usage. So they can help walk them through that. Any more questions on that? I'll flip the page. Okay. So for the health insurance, we're going to kind of go through some claim data, what your current plan designs look like, what the renewal for the current plans look like, and then we put some alternates in here for you guys. Based on the timing that you had, we didn't have any time to go to market to kind of look at other carriers. So it's literally, this is what we have. The good news is Florida Blue owns the Panhandle. Okay, so most of the companies around here are covered by Florida Blue. They have a great network of providers for everybody. People are familiar with them, so it works very well. So as we look on the next page, which is page 9 for you guys, this is a high-cost claimant summary, and you cannot see this from the back of the room, okay? But if you saw this, basically what this shows us is, on this page, we had 12 people that had claims on this page that went over $5,000 last year, okay? In the last 12 months, it's a rolling 12-month period. And then on the next page, which we'll flip to in a minute, there's another 18 people. So we had 29 people last year that used claims in excess of $5,000. The highest one being in total billed claim of $1,798,000 at the very top. And the insurance company paid $110,000 of that $1,700,000 billed claim, okay? So that's important for us to know because as we flip the pages and start going through, a lot of times we're scared about how much the bills are, but when you start looking at how much stuff got paid with the insurance providers' network discounts, things that are double billed, that kind of stuff, it helps really kind of get a picture of. We have 30 people, basically, that really use the insurance, but you had 60, you have 100 people that didn't use it that much at all. So we have to take care of both of those sets of people, okay? So we won't spend a lot of time on that, but y'all can go through that list and you can see what some of the conditions were on the left. There's no personal health information on there. There's nobody's names on it or anything like that, so just kind of keep that in mind. The next page is the prior period. So the year before last, you had 34 people that went over 5,000. So you had more people using the insurance than you did past year. So it's just kind of give you a little food for thought on that. But you can see the total. If we look at this, by the way, we go back to the first page real quick. $671,000. These 29 people accounted for $671,000 worth of claims. You only had $800,000 of claims for the whole group, okay? So basically, you ended up, the rest of the group only spent $100,000. These 30 people spent all the money, okay? So what we're going to do is we move forward and kind of show you some of the plan designs. I want you all to see that we can really help reduce the employees' cost of coverage, take care of everybody, and still take care of the people that have the high-cost claims, which is the goal. Okay, so let's skip to page 13, if you will. 13 is about the prescription drugs. So this is just a report on your drug usage as it may be. $200,000 of y'all's claim spend is prescriptions. $200,000 of the $800,000, okay? So basically is prescriptions, huge money. But y'all's plans that you have, y'all have 3 plans that are grandfathered, what they call grandfathered under the ACA. So there's really, they don't have some of the newer things that people are doing to help save money. So this shows us here that basically of the prescriptions, so if you look at the very top, and you all can see this, it's hard to see on the screen, I apologize, but you all had total people getting a prescription filled of 108 people. So 108 people that are covered actually got a prescription filled. We had 2,370 total prescriptions for those 108 people. Of those 2,002 of those are generic prescriptions. So the majority of the prescriptions are generic drugs, okay, which is great because we're going to talk about that as we move forward. Multi-source of people that could have taken a generic and they didn't. We had 33 prescriptions that could have been generic that weren't, and then the stuff that you saw on TV is what they call multi-source brand without generic. That's everything you see advertised on TV. That's outrageously expensive. We'll talk about how to help the employees go through that and help them save some of their money for themselves. But if we skip down on here a little bit, and I know I'm covering a lot of ground real fast, but you can see the plan pays where it says cost. Plan paid PMPM, $150.35 per member per month just for prescription coverage. So that's included in the premiums, along with expenses to run the plan, profits for the blues, that kind of stuff. The members paid $30.05 on average for prescriptions. Total generic cost only $44 for the generic drugs, and the brand names are $135. So what we're going to try to do is get people to talk to their doctors about what do I take. There's no harm in asking. You always want to do what the doctor wants you to do. There's no harm in asking them, what should I be doing? Okay? So as we move a little bit forward, we are going to talk about generic choices. Florida Blue has a program called Generic Choices, and we think we should put this on one of the plans. And basically that plan limits those people to generic drugs and some name brand drugs. We have thousands of people covered under this. Thousands of people covered under this plan, and we don't have anybody calling our office complaining. Okay, it really works well. So we'll go through that in a minute. As we move forward, if y'all will go to page 15, this is where we get into the nuts and bolts on the money. So the actual renewal that Blue Cross and Blue Shield gave you guys after all the negotiations and whatnot is they landed on a 3% increase. So if you don't want to make any plan changes and you just wanted to roll forward, a 3% increase, which in the world we live in today is a good increase, okay? If your rates were lower, but your rates are really, really high, okay? So the 3% is a big number. Y'all's PPO plans that you have, y'all, has anybody heard about the Cadillac tax under the ACA? They talk about it a lot on TV.
Explain it.
Okay, Cadillac tax basically says that if your plan has more economic value than a set amounts in the ACA, which is $10,000 for single coverage, it's not exactly 10, but it's 10.3 or something, and then it's for family coverages, if it's over 27,000, that the employer has to pay a 40% excise tax to offer those plans to the employees, okay? This has been a huge subject of controversy in the legislature, and they're trying to get it repealed. That's part of the repeal and replace of the ACA. But basically, your highest plan after renewal, you're already at the Cadillac tax, and it goes into effect January 2018 if they don't make some sort of change, okay? So you're already at the Cadillac tax. So what I tell you is we're really trying to look, how do we avoid that? How do we avoid paying the Cadillac tax for the city? How do we avoid paying some of the high premiums that the employees are paying, okay? So you had a 3% increase with no changes. If you look at the next slide down, it actually breaks down. Now this is how you read this. If y'all will walk through this with me real quick. What we've done is you'll see the monthly premiums over on the left. The top section of bars are the monthly premiums. Those are the actual premiums for the insurance. The next is what the employer currently contributes to the cost of the plan. Does everybody see that? So the next row there's the employers. On the far left where you see 22,141,04, all those little numbers, that's the number of people that are in each one of those plans accordingly on the plan. So, for instance, in the 5302, you have 22 people that have single coverage. Does everybody see that? It's usually easier for me to stand there and point this out or have a pointer. So, but you have 22 people that are already in the 5302 plan, which that plan has a $5,000 deductible already, and it has some copays that you can go.
$5,000.
$5,000.
Deductible?
Deductible. So currently today,
Already.
if you're in that plan and you go to the primary care doctor, you pay a copayment. And if you go to the specialist, you pay a copayment. And the copayment for that plan currently is $30 if you go to a primary and $55 if you go to a specialist. Okay, you can see that it's on this little sheet. But if you have to be in the hospital, you've got to pay the first $5,000 of the claim. And then the plan pays 80%, you pay 20%, until you've reached the max out-of-pocket of $6,350. Now, in this plan, this is your only plan that is compliant, okay, with the ACA. The other 3 plans are not compliant. And what that means is the prescription drug card copays do not go to the max out-of-pocket. You don't have preventative care covered at 100%. There's a few other nuances in there. So we're going to recommend that we make all the plans compliant as we move forward, okay? So on the other plan that you have, the richest plan, most of the people are on your highest option plan, which is a $500 deductible, which is, hey, by the way, it's a lot better than $5,000, right? $500 is a lot better than $5,000. But the employees are paying a tremendous premium to be under that plan for the luxury of having that $500 deductible. So if y'all kind of bear with me for a few minutes as we go through this, it'll make a little bit more sense. So if we go down the plan, if we look to the next page that we were on a second ago, you'll see what the city contributes. And then what the employees' monthly contributions are. This is what the employees are kicking in towards the cost of the coverage and the employee payroll deductions. So this is where we talked about it, how important it is. So currently for the $5,000 deductible plan, the employees pay $89.17 a pay period for their own coverage, okay? That's the one that's not compliant. We're charging too much money, okay? If they had their spouse covered, it's $339 a pay period, okay? So those are big numbers. If they buy up to the richest plan, so they're going to buy down that deductible and not have that $5,000 deductible, it's $142.47 a pay period for single coverage. And if you're one of the 2 people that have family coverage, you're already paying $592 a pay period. So huge numbers, okay?
It's hard.
It's hard, okay? So if we renew it and you pay the same percentages that you're doing today, those numbers are going to go up, okay? If you don't make any changes and you say, hey, we like the 3% increase, we're just going to renew it, the single coverage is going to cost $91 a pay period. It's not going to be compliant. You'd have to lower it down a little bit. And on the buyout plan, it'd be $146 pay period. So you can see what those numbers look like. So what our thought process was, if you'll go to the next page, please. First of all, skinny the plan down. So we went from 4 to 3, if you'll notice that when we flip the page. You have one plan that nobody's in today. So you all already have an offering that nobody's in the plan. So let's eliminate that altogether. And then let's compare the renewal at the 3%, which is the middle section of this, the green section, to an alternate that we think would work great for you guys, okay? Is we keep the 5302 plan, which is your lowest cost plan. But, as I mentioned to you before, we want to focus on the prescriptions because the prescription drugs are driving a big cost in the plan. So in this plan, we think we should adopt the generic choices drug card. Instead of full drug coverage where you can get whatever you want, it's going to limit the employees that take this plan to generic only, plus if you're on diabetics, you can get some name brand drugs, but generally it's generic choices. As I mentioned, we have thousands of people covered under it. It works really well. Our employees know how to help the employees through this process to make sure that they get where they are. We already know that 85% of all the prescriptions that you guys are getting today are generics anyway, so those people are going to fall into that plan very easily if they want to. If we do that just by changing the drug card, the cost goes down from the renewal is $734 a month, and it goes down to $594 a month, okay? So we can lower the cost of the plan tremendously. Then, nobody has a $500 deductible anymore, okay? The plan's a dinosaur, which is a really nice thing for your employees that can't afford it. But keep in mind, you have 50 employees that don't even take your insurance, over 50, okay? Don't even take it. They can't afford it, okay? Which is really, we try to make it more affordable for them, okay? So we offer a higher deductible plan, which nobody in the room, especially if you're an employee, is going to like seeing that you're going to have a $2,500 deductible. But if you'll bear with us for a few minutes, we're going to fix that, okay? So this plan has a $2,500 deductible. It pays 80% after the deductible, and the maximum out of pocket, $6,350, and currently that is only $3,000, okay? But we've got a fix in it if we kind of keep flipping the pages in just a second. The copays go up a little bit. It has a real prescription drug card. You can get any kind of prescription that you want. It is a generic mandatory, so if there is a generic available, the pharmacy is going to make you take the generic, okay? But that's standard in the plans today. But the cost of the plan for the whole company would go down 13.6%, okay? So the city could save some money. So we drop down to the next page, and we'll come back and go over, answer questions about individual things, okay? We drop down to the next page, and what we were thinking about doing was, how do we get more people involved in the insurance where it's making it more affordable for the employees? So what we want to do, what our suggestion to you is to do, is to pay more towards the cost of the insurance today, because we lowered the premium, right? So we lowered the premium, yes, sir?
And I'd like to interject there. Part of the issue, and just let you know, over the few weeks I've been here, we've had probably 3 or 4 employees leave, and some of them is for better opportunity, which I could never fault any employee for leaving the city for a better opportunity, better benefits, and things of that nature. One thing that I heard from y'all, and I've heard from the employees, and I appreciate y'all here today, is the insurance is too high. So one of the things that he's fixing to go over is paying more towards the employees, since we can make some adjustments to lower the overall part. And that does 2 things for the city, for me. One, it allows my management team for retention of good employees. And also it gives us a bigger pool of possible people we can choose from in the future, because they do look at benefits. And for instance, Matt, we was about ready to offer a job to a young man to come on the police force last week. He went to Panama City, benefits a little better. He wouldn't even come back to us. So, just things like that. So I encourage you, when he's going over this, and I'll answer any questions, for the benefit of the employees, I do recommend that y'all look at increasing the amount, which makes us a little bit more competitive with the county and some other local cities, because we are losing some employees. Sorry, Owen.
So if you look at this alternate one on this sheet, the blue for you guys, if y'all can see this. This was, we have lots of these. If we flip the pages, you're going to see lots more of these, okay? But the alternate one was the same premium. You'll notice the premium stays the same as the changes that we made on the top page. So it's still $90,170 a month. That is a big, big number, okay, for all the employees to write a check to Blue Cross, right? The lowest option plan that has the $5,000 deductible, we'll get to in a minute, but we're going to recommend that you guys implement a health care reimbursement account to help the employees pay for part of that deductible, okay? So that they don't have a $5,000 deductible. We'll buy down on it, but I'll go over that in just a minute. But the first thing we want to do is, how do we fix the cost? So you'll notice on this sheet, what we think y'all should do is pay 90% towards the employee-only coverage. Today, you pay 75% towards the employee-only coverage. And the premium's $200 more a month, okay? So at 90%, the employee's payroll deductions would go from $89 a pay period to $29 a pay period, okay? Happy, okay? And in this situation, we ran it that on the high option plan, you'd pay 75% of the cost for the high option plan, and those people's payroll deductions would go from $142 a pay period to $105 a pay period. So the city, when we're all said and done, gave back, I basically made a note of this, okay, because it's a big number, basically $12,552 a month to the employees, okay? $552 a pay period, excuse me, okay? $25,000 a month to the employees, right back in payroll deduction, less payroll deductions. That's real money, okay? So then we made some other alternates in here. So if you'll look at the next page, we ran multiples of these. So that you could kind of see what it would be with different percentages so that you can pick. But all of this gets you, even after you make these changes and you get the employees' lower deductions, you're still at a lot lower than our renewal is. So we're spending less money than we do at renewing the plan at 3% increase. And all we've done is change the drug card on the low plan. We increased the deductible on the high plan. But let me tell you how we envision the healthcare reimbursement plan would work, okay? So for you guys, we'll come back to this. We'll come back to that last page. The healthcare reimbursement plan would work like this. First of all, we'd lower everybody's cost. So you already saw that. So there's going to be, people will have more money if we adopt the flexible spending plan. They can take some of the money they save, put it in the FSA to help pay for part of their new deductible, okay, that they're going to have that's going to go up. But on the 5302 plan, if y'all could see this from the back, y'all would see that the deductible is $5,000, and the employee's responsibility, we think, should be the first $4,000 of that deductible, okay? So the city would kick in the last $1,000 of the deductible. But the employee is going to save, sheet over here, they're going to save a couple of $1,000s in payroll deductions. So when we're all said and done, we're actually lowering how much money the employees would have to pay if they have a catastrophic event. And if there's somebody that hardly ever uses the plan, which you do have some of those, they just save money. That's just money in the bank for them, okay?
And currently, Owen explained to them that, currently the city does not help out with any of that reimbursement.
Currently, the city pays for none of the deductibles and no of the co-insurance. So, and this is just food for thought, okay? But what we think is if you pay for $1,000 of the deductible on both plans, the last $1,000, employees need to have some skin in the game, so to speak. We want them to ask questions when they go to the doctor and that kind of stuff. And then after the deductible, there's a co-insurance percentage. So on the low plan, after you meet your $5,000 deductible, the plan pays 80%, you pay 20%. We would recommend the city pick up all the 20% co-insurances. We would administer the healthcare reimbursement plan for you guys at no cost, okay? So we will administer that for you.
I'm sorry, could you repeat that again?
So a company of interest, we are a licensed third-party administrator, so we'll administer the healthcare reimbursement.
Now, the part about who's covering the 20%, the city, you're
So
talking
the
about the
city would
city?
cover the last 20%. So the city's liability on a single person, or any person that's covered, basically, would be the it'd be $2,350, okay? So it'd be $1,000 for the deductible, and then that co-insurance is $1,350. So we'd cover that $1,350 for that person too. So it would be $2,350 if somebody had a catastrophic claim, okay? Under the high option plan, we would have it the same thing. Everybody would get reimbursed some money. The employee would have a $2,500 deductible. They would be responsible for the first $1,500 of that deductible. And then the city would pay for the last $1,000. And then their max out of pocket $6,350, and they would be responsible for paying 20% up to $3,350, and then the last $1,350 of that would be covered at 100%. Okay, somebody would have to have greater than a $16,000 claim if they were in that plan to hit that number, and we had 10 people that had that. But those 10 people didn't all get deductible usage. Some of them were just drugs, and they would have just paid a copayment. Okay, so realistically, if we have 10 reimbursements, we'll plan for 20, okay, which is $47,000. If we plan for 20 people to use all the money, it's $47,000.
And what we're doing here, we're betting against the chances that the employees go over the amount on their deductibles or meet their deductibles, and if they don't, the plan does better because we have lower rates because of that.
But we're really trying to lower the cost of the employee. I mean, truly. So if we look at it today, and there's a sheet in here. Will you flip forward, please? Go back. So again, right there. You can't see this from the back, but if you could, I'll walk through it. I'll just tell you the big picture. If you're in the lowest option plan today, this is number, in y'all's booklet, it's page 22, okay? So y'all have another sheet that's stuck in there because we did that on the fly, the last piece. So we did that at the very end, okay? But on page 22, the 5302 plan today, if you're in that plan, you have a deductible that's $5,000, which is in this is the middle section of the plan right here, okay? Employee only cost, it costs the employee $2,140 a year today for coverage under that plan. That's what they're paying for their coverage. If they have full family coverage, which you have somebody that's in that bucket, they're paying $10,683 for that coverage. What we recommend we do is you'd have a $5,000 deductible still. That did not change. The maximum out of pocket for the employee would be $6,350. The employee's annual cost is $2,140. So basically, if that person had a catastrophic claim, they would pay $8,490 out of their pocket that year. Okay, does everybody see that down there in the middle? If you go over to this alternate one, we would start the $5,000. We didn't change anything there. We didn't change the $6,350 out-of-pocket max. We did change how much the employees pay. Now they only pay $712 a year for the coverage. So we'd give them $2,350 if they had a catastrophic event, okay? And so their cost now would be $4,712. So the math on that's pretty big, right? It's half of what they're spending today. And they get to save $1,427 in premiums. So if they took that $1,427 and put it in a flexible spending account, we could lower that $4,700 by the $1,400. They're a lot lower now. They're $3,300, okay, versus $8,400 today. So we're definitely changing how people look at paying for their insurance. On the high option plan, if we use the math that we used in the alternate one, we would have a $2,500 deductible, $6,350 out-of-pocket max instead of $3,000. But because the employees saved so much money they saved $897 on their payroll deductions after their $2,350 healthcare reimbursement account, they would have spent $6,500 instead of $6,400. So the employees on the high option plan, they're spending a little bit more, but they're buying up to the richer plan. Those are the people that are a little bit more unhealthy. And then, so we did another, the one that was slipped into your packet, you could see, that was just a freestanding page. That was kind of, Mr. White had asked us to run it at the employer getting a 95% contribution to the low option plan and an 80% contribution to the higher option plan. And basically it makes for a 1.6% increase. That does not include the $47,000 that we would want for the healthcare reimbursement account to kind of set aside. But even if we add the 47, we're still at about a 4% net increase over last year. But the employees now have, they're spending $33,000 a pay period today, or $33,000 a month today, and it would go down to $18,000. So they'd save $18,000 in payroll deductions.
So basically what the different options are on medical, which we gave a total of 4 with these 2 plans. Listen to y'all individually and together up here on insurance, and listening to employees and going through this, you're looking at besides the health reimbursement account, you're looking at a 1.6% increase. If you increase the dependent coverage with the employee coverage to 95%, so the city would pay 95% of their premium, and the employee would be responsible for 5%, and then still pay the 60% like we do today on the dependent coverage. And then the more richer plan, we will step it up from 75 to 80% we pay, and then 60% of the dependent costs. So for instance, today, employees are paying $89.17 for the normal plan, the standard plan.
Just covers them, right?
Just covers them.
The employee only?
Yes, ma'am.
Okay.
And if you go over to the next column, you'll see they will pay $14.85. So the employee will basically pay a little over $7 a week to cover themselves for insurance. If you do the rich plan, it's going to go from $142 every 2 weeks to $84.05. So each employee, no matter if they decide to go with the 5302, which is a standard plan, or the 5773, will see significant savings. And the overall cost of the plan will only go up with the HRA plus the 1.6%, compared to what was going to pay a 3% increase.
Just playing with the math.
Sorry about that.
No problem. Don't be sorry. That's good. It really works, So you can see kind of what we're trying to do as far as the money goes. And our staff is very trained in this to where when they come and visit with the employees, they can explain to them how the generic only card works. They can explain to them, because you'll have a lot of employees, maybe I'll gravitate between the higher option plan to the lower option plan. Who wouldn't want to pay $14 pay period for insurance versus $89? You know what I mean? So that's just a thought. So the next, if y'all can flip ahead, we've got a lot of ground to cover still. On the dental insurance, we did get an option, so we did have time we had a whole day to get a marketing on this, so we were able to, in a whole day, you can actually get a dental quote, okay? So we did get a dental quote, so we were able to change the Florida Combined Life dental plan to a MetLife plan, and the cost actually stays exactly the same if y'all want to do this, and it makes no difference to us if y'all want to do it. But you'll notice the one thing that changes is the max out of pocket, so the maximum benefit would go up from $1,000 to $1,500 a year. So right now, the insurance only pays $1,000 a year, and so it would go up to $1,500. So it'd go up 50% for the same amount of money.
So the employees will get more benefit for the dollar. And we, based on percentages, because we pay this as well, part of the percentages.
So same amount of money, we just get more benefits. Then if you'll go, please bear with me for a minute. The vision plan, we actually, y'all do not have a vision plan today. This would be a voluntary benefit, so you wouldn't have, people don't have to buy it if they don't want to, but if they want vision coverage, they can get a plan that basically covers their eye exam for $10, contact lenses exam for $60. They get a $130 allowance for frames, $70 allowance at Costco. You can see the little list there. And it's $7.82 a month, or $3.91 a pay period for single coverage. So really inexpensive. They can pre-tax this, so it really costs them less money. We're big fans of pre-tax money. Saves you at least 22.5 cents on every dollar you spend. So you're already doing it on the medical insurance. We would just pop the vision insurance on there as well. That's just an option to basically round out your benefit plan for the vision. It's voluntary, doesn't cost the city any more money, just a benefit for your employees, kind of building that for you.
Can I ask, how many people do we have on that dental plan now?
I do not have that in front of me. I don't. There it is. Oh, I've got it. So we have 76 people that have single coverage, 21 employee spouses, 13 employee children, and 22 full families. So quite a bit. So
I think our goal is to try to get as many employees on this plan and at the same time put more money in their pocket.
Absolutely, sir. That's what this was all about. And increasing the service where right now we do not have an HR person, so Vicki is having to do multiple duties. God bless her for that. Yes, ma'am. So they would become an extension of us.
if we'll go a little bit, we had some ideas on the life insurance also, if you'll move ahead a little bit. Currently, y'all provide, the county or the city provides every employee with $25,000 worth of life insurance, every full-time employee, so if they happen to die while they're employed, they have $25,000 worth of coverage. We would recommend that you guys, there's no increase on the premium on that if you wanted to leave it the same, but we'd recommend that y'all move it to $50,000 worth of coverage. At $50,000 level, you don't have to do any special tax reporting or anything, so you just move the employees from $25,000 to $50,000, and you can do that for $625, $640 for the whole group a month. So it doesn't cost a lot of money to give all the employees an extra $25,000 worth of coverage. So for $600, you can see the total premium there for the whole group would be $1,650. Right now, you're spending $1,012, so it wouldn't cost a whole lot of money for everybody to get another $25,000 worth of coverage. Y'all probably had $25,000 for a very long time. Funerals used to cost $25,000, now they cost $50,000. So, cost a little bit more money. The next page, page 29, we would recommend that you offer your employees a voluntary group term life insurance, which is very, very inexpensive group term life insurance on a voluntary basis. So the employees could buy this with no evidence of insurability up to $100,000 worth of coverage. So what that means is that if they wanted to buy an extra $50,000 worth of coverage, and on your program on the right-hand side right here, we've got some ages, and it shows you how much it costs. So if I'm 43 years old and I want to buy an extra $50,000 worth of coverage, it's 19 cents a thousand, okay? And you can see there, the total annual premium is $9.50 a year, okay, for that. So really inexpensive coverage for that. Okay? I'm going kind of fast, so if y'all want me to slow down, I'll slow down, but I figured we'd get through it and then we'd have Q&A, right? On the long-term disability, this is something that we just threw out there to round out your benefit package. It's something you don't have right now. So if an employee gets sick or hurt off the job, they have no coverage. Right here, they're covered by workers' compensation, but if they get sick or hurt off the job, you got to work it out. So this would be a program that you would offer. We have it run here as employer paid, okay? So in other words, the city would actually pay for this. We could do it voluntary if you wanted to, but it would cost a lot more money. But it basically would pay the employee 60% of their income up to $5,000 a month if they got disabled and they couldn't come to work. So after the 91st day, they would start accruing benefits. 120 days later, they get a check. Okay? So it would be employer paid. Some of the stuff that's in here, it's got a pre-existing condition on it. So if somebody has a pre-existing condition today, they already have cancer, they already have stroke, they have to have had a stroke or a heart attack, and they're back to work. They have to be covered under this plan for 12 months before they're covered for that condition. But for everything else that's wrong with them, they'd be covered from day one. Okay? So long-term disability, and you can see there, so for the whole group, it's $3,184 a month. So a little bit more expensive there than some of the other stuff, but you're also, if somebody goes out and they're 30 years old, and they get $3,000 a month, they're going to pay them that till they're their normal Social Security retirement age, which is 67 years old if you're 50 years old today, okay? So just a little bit on that. Y'all ready to move on? I'm just moving right along here, aren't I? And then once the system is actually built, it takes us about 90 days to build the electronic enrollment system. But all these benefits will be in one place so that everybody can see it. One of the things that we can put on there, voluntary group critical illness plan, so it basically covers every single person this is voluntary, so the employees would do this if they wanted to. They don't have to do it if they don't want to. But a lot of them would have this type of coverage today, but this would be a $10,000 benefit if they had a cancer, stroke, heart attack, that kind of stuff. Would pay a flat $10,000 benefit, and you can see that the rates are down here at the bottom. So for $10,000, if you're 40 to 49 years old, it's $20.61 a month, so about $10 a pay period for single coverage on that. And if you wanted to cover your spouse, she's $11 additional, so a month, so another $5 basically, okay? So basically, help the employees offset the cost if they got sick or had one of those illnesses, critical illness that they had. It's a first occurrence benefit. It has some recurrence benefits in there, but it really just kind of helps the employee put money in their pocket if they have one of those things. Participation-wise, we don't have a participation requirement, so we'd be okay on that. And then on the group accident plan, like if your kids play softball and stuff, a lot of people have accident insurance to help cover those. And we put that on the platform as well. So really a full benefit package for your whole, for the whole city that includes, a little higher life insurance, the disability insurance. It has some voluntary benefits in there, a lower cost health insurance option for everybody, really with some help on the deductibles through the healthcare reimbursement account, and just a really solid plan.
All right, one of the big things too, are you through with that? Would you go over the
I think that's it. I think that's almost everything I went through. Nope, the very last thing in here that I put in there.
Yeah.
There's always one more thing, isn't there?
Yeah, part of this, and one thing here I'd like to look at, this telemed, a lot of us go to the doctor a lot of times with a cold, and we try to treat ourselves so much, and a lot of times you know what you need. You need a Z-Pack, or you need something of that nature. This benefit right here is something that, I would want the city, regardless of some of the other stuff, definitely look at, because it can help control the cost in the future for our plans. And what this is, it costs the city $3.50 a month per employee. But however, if somebody has allergies, if they have a sore throat, if they have anything, and that's $3.50 also covers their family. So if their family, if their child is sick and they know what's wrong, they can talk with a doctor 24/7, anytime they want, and the doctor can prescribe stuff, and they can go pick it up at the thing. They don't have to go pay a copay. They don't have to go to the doctor, for minor stuff. And that's what it is. If it's something serious, they're going to recommend that you go to the doctor. So you'll be consulted by a doctor on the phone. But go ahead, I'm sorry.
If you don't mind, I've got a question.
Yes, sir.
That's per employee, or is that per insured?
Per employee per month, and that covers their families.
Yeah, but that does, so if I've got an employee that opts not to buy the insurance,
We can set.
they can still use this?
They can still use that, yes, sir. So 150 times the $3.50, everybody would have that coverage,
okay.
have that benefit.
Okay.
So it is not compliant from a standpoint of like ACA, it would count as your health insurance, but it is really helpful at 2 o'clock in the morning when you get up and you want to call somebody and just maybe check to think, should I be doing something different?
One thing I think of is Public Works. If we can keep a couple of those guys, if they, have a sore throat or something, if we can get them back to work quicker, it can continue, won't interfere with work as much as it does now because, we have a crew here and a crew there.
I really like that part of it, because if you've got an employee that still doesn't want to buy insurance, even at the lower rates, they've still got access to a doctor without having to pay. So, and I understand it's not a full-service doctor, but still,
It
that's
does work
definite
very
benefit.
well, I will tell you that, it does work really good. We actually recommend everybody call, get set up before you're sick, that kind of stuff. That's everything.
That's
It's
everything.
that's like drinking through a fire hose, right?
So that, at this time, what I would like to do then is to allow questions from the board, and then once the board has finished asking questions, if you can bear with us, then I'd like to open it to the employees and to the public, anyone who has a question or a concern or just a statement you'd like to make. And, if you'd like to make a statement about just what you think the commission ought to do or not do, please do not be shy, okay? If you're an employee, this is your opportunity to say what you want to say, so please do. So at this time, I open up to questions from the board for the insurance company. Thank you for that presentation.
No problem, thank you.
I would like to ask a question.
Yes, ma'am.
For an employee and his family, or an employee, spouse, and 2 children,
Yes,
under the 502 plan,
yes.
what would their monthly payment be?
Depends on which one of these you guys adopted.
Go with funding,
But
option 4.
option 4, so they would go today, and you only have one person today that actually has that coverage, by the way, okay? But that one person's paying $445 of pay period today. It would go down to $266.
Must be looking at it wrong.
Yeah, we're looking at these.
You're looking at the premiums at the top.
I don't even,
The-
I'm not even looking at that, that's
Look
why I
at
asked you.
the freestyle sheet.
So, what I just asked
Yes.
you, an employee, spouse, 2 children?
Yes.
Would be $266
That would-
per month?
Per pay period.
So it's
It's right,
5.
it's right there.
So that's
And that's what they're paying now.
$533.42 a month. That's the employee's portion. The city's still kicking in $1,319. The total premium for that family is $1,853. Y'all's rate increase with the rate increase, if y'all would just to renew as is, on the high option plan, the premium, you saw it in there, if y'all want to go back. I think it's astounding, only because I've never seen one that big, okay? Is only, and I do this every day, okay? $3,052.20 a month for a family to have health insurance. That is high, high, high. Okay, so what we're trying to do is kind of to reset that bar a little bit. It's still $2,622 is with the plan changes that we've made.
I'm very eager, and I sure hope the employees will speak up. I'm so eager to find out how many would be in favor of spending $445 per month out of their paycheck for your whole family, or just 2 children. That's a whole family.
That's a whole family,
Doesn't matter how many children they have.
correct. You only have one person that's taking advantage of that today. Okay. And you have 2 people that are in the highest option plan that have family coverage, that are spending, currently those people are spending $1,185 a month.
And that's per pay period.
And then the per pay period is $592 at the bottom.
Okay, let's keep all of our comments
Sorry.
open to the
Sorry.
public. Okay, if you'll direct them openly so
Yes.
everybody can hear.
Sorry.
Thank you.
I really want to hear from the employees.
Mayor,
Yes. Who's,
Must be.
oh, I'm sorry, Commissioner Friend, I didn't know you had joined us. I thought it was God speaking to me. Go ahead.
well, I love you, but I'm not God. Thank you, Mayor. Let me just say, first of all, Mayor and Commission, I really appreciate you accommodating my travel. This is a very, very important topic. I have been following along, and I appreciate the presentation. The first thing I would like to ask is the SSA account. I believe in SSA account. I hope the employees can recognize the benefits of that. But during the presentation, I don't know if you touched on it or not, but it does say that the employer can set the minimum so that it doesn't have to be so high. My experience with SSA is educating. We have to make sure that if we participate in this, that the employees know that they can lose the money that's left in the SSA. So if we can set the minimum and we can roll over a minimum of 500, can you give me a scenario that maybe we could set it at 1,500?
It can
Or
be
even
set
all
at
the way down to 500?
excuse me, Commissioner Friend, but it can be set at 1,000 is my understanding.
Yeah, we can do it, you can do 1,500, 1,000, you
Or
can do.
it can be 1,500, but the minimum, the lowest could be 1,000.
That is correct.
Is my understanding. And,
Excellent.
and that is, it is important that everyone knows that when they have that type of account, that it's, non-refundable at the end of the year. And I can remember as a very young teacher, remembering the salary at that rate, you're thinking, I don't know if I can put aside $20 this week because, I've got to buy this with it or whatever with it. But if you can look at your last year's bills and make an estimate to what you might spend, you don't, I don't recall too many people ever telling me that they didn't use it, when I was younger. I remember that, so.
Exactly. Thank you, Mayor.
Even as administrators.
And
Well, I was referring to the days of the salary I remember when the salary was $13,000 and I was wondering, what I was going to pull out of that to put on a health plan. So that's what I was referring to, and
And
it's
if
not a
I-
good thing.
if I may, Mayor, that is a voluntary thing. I mean, it's not required for the
That is
employees.
correct. No, the employees would pick and choose whether they wanted to participate or not. Only thing you'd be doing as a city is saying, hey, by the way, if y'all want to do it, we're going to offer it to you, and we're going to pay the admin fee. And like I said, there's a little risk in there. If somebody was to leave, they could leave the money, but in the end, it's worth the money.
And the risk you're referring to,
The risk-
if they decide to open the account, that account is fully funded for whatever they agreed to put in it.
Correct.
So that money's automatically there.
It's there.
So the risk would be is if they used it and quit 2 months into the job, then.
Exactly. They'd have to game you. They've got to be thinking ahead. So, they are smart though.
Other questions?
I'm sorry,
Go ahead.
but, so for the benefit of the employees, it'll spread an expense out over the year of something that could occur in February.
Correct.
Say they have to have a deductible in February, they've got to pay, they could use that account to pay it, and then they could spread that deductible over the rest of the year.
Correct. And we would recommend, just so y'all know this, we need to get this done now for 10/1, but to make it easy, because the deductibles run calendar year, we'd recommend we do a calendar year FSA, right, it's from January to December. So we'd probably come back and have people re-enroll in their FSA. So they wouldn't be making that decision right now. We just need the adoption of it now so we get it set up. Does that make sense?
Yes.
Because if we did a plan year, that would work great from y'all's standpoint, from a budgeting standpoint. But the problem with the employees is they would plan year out and they wouldn't have enough money.
Yep.
Okay.
Other questions from the board?
Well, yeah, if you don't mind, I've got one
Sure.
more. So by my calculations, if we leave the status quo as it is with a 3% increase, we're looking at 107 and some change. If we go with the 95% plan we're talking about at 72, that's a $35,000 a month saving that the city is going to see.
Well, the net's really, today you're spending 70,000, so it would have gone up to like 73,000. So if you look down at the bottom of that, so it's 70,000 today, and it would go up to 72,000 if you're left it the same. So the net cost, yes, sir, there is a net to that. The actual premium at the top of the page, the total premium for the insurance today is 104, it'd go to 107. We're going to lower it down to 90,000, but we're going to give a lot of that back to the employees in payroll deductions. Does that make sense?
We'll go to the employees, it's to the city, and we almost remain status quo. 1.6% increase versus if we just stayed where we at today, that'd be a 3% increase.
And then how do we fund the HRA?
The HRA,
It'd be 1.6% plus the HRA contribution. So let's say it's $47,000. Okay. I'm telling you, that would be a really, really big number for HRA contribution. But if it was.
I like the concept of the, well, obviously I like the 95%. I'd prefer to see 100%, but I've been, I don't want to say schooled, but I've been explained why maybe 100% is not an option. But the $5,000 deductible for the upper plan, I would like to see the HRA reimburse the employees more than just 1,000.
we can do anything you like. We're just putting numbers together. Part of what I'd like to do, Mayor, if after all comments, I'd like to go through each thing individually and get y'all settled on, do you want FSA or no? Which plan do you want, dental, those kind of things, and then we'll roll it all up into a motion.
And I think that sounds like a really good plan. And I just had one question as well. With the 95% funding and what we're talking about, does that make us, I've been looking at some of the other cities in the county, and I think if I'm correct, that brings us into a competitive level with everyone else.
Very competitive, and I think you would have a lot of happy employees.
Okay, because Lynn Haven is the second largest city in Bay County, and we do need to have our employees feeling comfortable about where they work and feeling like they're cared for and feeling like they're respected. And I think that this might be a good step in that direction. So any other questions or comments from the board? Okay, at this time, I'd like to open this to the public, and this is only to speak on the insurance, no other topics at this time. There is an item 5, or excuse me, yes, item 5 later if you have other topics you want to talk about. But any employees, any members of the public who would like to come and address any questions or concerns about this insurance proposal, this is your opportunity. So I welcome you to the podium. Sure, come on up. And per Florida statute, you do not have to state your name, address, telephone number, anything else. You can just chat. Just tell us what you
I
want
will
to say.
volunteer it. I'm Steve Infinger. I'm a police officer here in Lynn Haven. I'm a single father. Is there, I couldn't see everything that was up there from where I was way back there, but is there an employee plus dependent option rather than just having to do a family plan?
Yes, there is actually, here, I'll show it to you while we're right here.
Sure.
This is actually there's 4 tiers of rates. So there's employee plus children, 1 child or multiple children. And it depends on which plan you're in, this is what the payroll deductions would look like. So very affordable.
Yeah.
Versus.
Yeah. I like that. That's what's really burned me in the past is it's either single or family. With me and just 1 child, I mean, I couldn't even.
Literally for the low option plan, it'd be $114 pay period, which is fantastic.
It is. Thank you.
Okay, thank you. Others? Yes, sir. Come on up.
I'll give my name too. I'm Mitch Oakley, a resident of Lynn Haven. Thank you for your presentation. It was good.
Thank you, sir.
The employees of the town, I hope you really get a good shake. I've taken 2 fairly large companies through this process. I want to caution you on the generic versus the real drug. It was a small percentage, but I now pay $430 a month for my wife for 1 prescription because she was in that small percentage that had to have the real drug. Okay, so keep that in mind. I would go to your doctors and screen me. Am I going to be able to go generic or not? The FSAs, the set-aside monies.
Yes,
You say you monitor those
No,
monies?
so the money for the FSA actually stays at the city until it needs to be funded.
Okay.
So the money's never leaving the city until.
I guess the
somebody
girl in
has
the
it.
room, everybody kept saying that the employees are here and I may lose it. If I lose it, do you walk away with it?
No, sure. Basically what happens is this, that's a very good point, okay? Thank you for bringing that up.
Yeah.
So the way the FSA works is the federal government says, hey, we're going to let you put this money aside, and you're going to get to pay pre-tax dollars and not pay taxes on it. And because of that, the employer's going to save some money too, and their risk is that they've got to make that money available to you day one of the plan, okay?
What's the disposition of that money? If I had $1 million left at the end of the year, for instance, that I didn't use, what's the disposition of that money?
Basically, they only can use the money to offset future cost of the plan.
Okay.
So as people, if they terminated and gamed you, like we were saying, and they ran off with $1,000, then basically, if there was $1,000 left in forfeitures, they would offset their cost, they'd have no out.
And final question,
Okay.
No problem.
thank you for this.
That's a good
My
question.
final question is, how are you how do you make
Okay.
your money?
Very good question. So we get paid commissions from the insurance carriers.
Okay.
And they're actually in the RFQ that they did is what we accept as commissions on the plan.
So you got set percentages?
Oh, yes, you do. Yep.
Okay, cool. Thank you so much.
Thank you.
Thank you. Other questions from the public? Yes, ma'am.
I was in a flexible spending promotion at Sally Mae.
Okay.
My question to you is, does that cover, we could use it for Band-Aids, aspirin? You're only talking deductibles. Is it just deductibles?
No, ma'am. So it's the flexible spending, they had a list of things that the government allows you to use it for. One of the things they don't let you do right now is over-the-counter stuff. Okay, they did for years before the ACA. But all of your co-pays, deductibles, glasses, braces, stuff for your kids, and even if you don't cover your kids under this health insurance plan, you can use your FSA money for them.
Okay.
Okay?
I also would like to say, I'm very grateful that y'all are looking into this.
Awesome. Anyone else have a comment or a question?
Hello. I'll comment. I don't really have any questions. You did a very good job of explaining it. Thank you. My name is Caitlin England. I was employed with the police department for almost 4 years at the city of Lynn Haven. I can say coming into the police department, some of the plans that we had, I was actually single and living on my own, trying to start a career. And at the time that I came into the city, I was not able to afford the insurance plan. Rent, unfortunately, right now is between $800 to $1,000 if you're going to some place that's decent. And when you take your police car home, it has to be a decent place, because otherwise bad things happen. So paying that and then trying to pay the insurance on top of it was just not even possible for me. And over those 4 years, I've also watched families come and go and other officers come and go because they couldn't afford the plan and they left for other opportunities. And I'll admit, I left the city of Lynn Haven because I went from here paying over $200 a month for insurance to a place that I only paid $30. That made up a big amount of money that I got to put back in my pocket. And even though the pay wasn't that different, that made a huge difference for me. I've actually ended up coming back to the city. I'm hopefully trying to get back employed, but that's because I like this city of Lynn Haven. I like the place that it is, I like the people that work here, and I like what it's about in general. So doing this and offering it to your employees, I really do honestly believe that you will get better employees and people that will stay longer because it is a good place to work. So I just want to say thank you.
Thank you. Anyone else?
Hi, my name is Mandy. I work over in the water department. I know Mr. Russell said that 100% wasn't an option, but why can't it be an option? I mean, maybe if you, had one plan that you offered everybody and paid 100%, and then if we wanted to pay for our families, we could pick up the difference. Could we look into that option?
I think that's a good question. City Manager, you want to address
Yeah, part of the reason is, if we have employees that are on military, just take the military, for instance, we're a military community, and should a lot of them have TRICARE? Yeah. A lot of them are covered under there. It makes, if we do 100%, it makes our insurance the primary coverage and not theirs.
Okay.
So that's part of it. And to be honest with you as well, I think as far as insurance, I think it's good that each employee has a little skin in the game due to the fact that we will be a little bit more cautious, I hope, by going to the doctor, maybe using telemed instead of going to the doctor as much, and try to treat yourself a little bit because ultimately we're responsible for the rates. Rates can be a lot better if our claims is not as high. And that was behind that decision.
Okay.
Mayor, if I may, Yeah, one of the things that was explained to me, that our rates are directly reflected by our usage. So the more our employees go to the doctor, the more they go get medicine, our rates are going to continue to climb. So the best analogy was, and I'm still that guy that wants 100%, but the theory is that we want you to have, like you said, a little skin in the game, so maybe you'll call telemed that won't affect the rate instead of going to the doctor. You know, but I still want to cover absolutely as much as we can, and that's our goal.
Anyone else have a comment or question?
My name is Ben Jenke. I have two questions. The first question, if I have to go to a regular doctor, what will be my copay? And then also for a specialist? And then the second question, you had mentioned that you didn't really have time in the last couple of weeks to really go shop and see if Blue Cross Blue Shield is the best choice for the city.
Yes.
So what do you envision if, let's say, the commissioners decide to go in this direction and hire you for healthcare services? What do you envision over the next 12 months?
That's a great question. Okay, question one on the copays. We can go over that for you real quick. So on the low plan option, the primary care copayment is $30 and the specialist is $55. And on the higher plan, it's $35 and $85. So you pay a little bit more on the higher plan because you have that real rich drug card, okay? We've kind of already laid out a plan for the city. One of the things that we were asked is about timeline so that we're not backed up like, y'all are not backed up like this again. So we actually have a timeline. 6 months prior to your effective date, we'd be meeting with the council to go over kind of how the plan looks, where it's going, what do we want to do for next year, and when we shop all the other plans out so that about 100 days in front of your actually effective renewal date, we already have those. So next year we will look at all other options, the Uniteds, the Aetnas, and everybody else that's in the business. So to really kind of check it. So this year, I think y'all made the final decision on Wednesday or Tuesday night last week, and Wednesday morning we got notified, and we had Tuesday, Wednesday, ship it over here on Friday for you guys, or Wednesday, Thursday, so it's been a little tight. Okay.
Just a scenario for the employees, the savings card that we were talking about, if you think about during the course of the year, if you went to the doctor 4 times and your copay might be $25, and that's all that you spent last year and you're a single employee, you might just want to put a couple $100s on that card. And then as Ben was just asking about the $30 copay or whatever, then you would have that Visa card to take with you, and you're only having a small amount taken out of your check every time, so you wouldn't really feel that copay at all, is the beauty of that. So it doesn't have to be, a huge amount at all.
I have a question. So if we, as a commission, chose to pay 95% of every employee, what kind of cost are we looking at?
The entire cost for the city, like the dollar amount?
What we would pay,
Yes.
yes. What would our part be per
So
month?
basically today, with the way that y'all have it set up today, the city's on the medical only, okay, just the medical insurance, forget the dental and stuff, which is really not very much money, but on the medical insurance only, the city's net cost today after the employees contribute is $70,863 a month, okay? Under the new plan that we're recommending, it's $72,117 a month. Okay?
And that would pay 95%?
Yes, ma'am.
Of the employee's cost?
Correct. Plus, I want to throw in there, keep on saying plus, the healthcare reimbursement account. So let's call it $47,000 a year, so we add $4,000 to that. So the net cost would basically be about $76,000 a month, and today you're paying $70,000 a month. Okay?
Any other questions or comments from employees or the public? Anybody? Looks like we've... Okay, I think what our city manager would like to do, and I'm going to just sort of join in the voting here, is he's just going to go through each piece of this for the board and see what the board has questions about or what you would like to approve, and then somebody can roll this into a motion for me in a second, and we'll see where we go. Thank you all so much for your participation.
I'm going to sit here and make notes if that's
Yes,
okay.
if y'all two would make notes, because Vicky's on the headset, she's going to make notes, and I'm making notes, so we get it all together. All right, I guess the first item would be the FSA. And the main thing here, as you know, is the city picking up the 485 administration for the employees who decide to do that. I guess the best thing, is there anybody want to discuss that, or anybody not in favor of that?
Quick question. Do we need a motion and a second on each one of these items?
No.
No.
What I want to do is straw you first, and then we'll go back through and make a motion.
Okay.
I think that's be the easiest, because, you know, keep making motions. All righty. All right, the FSA. The next thing we're going to come to is the medical. You have 4 different options here that we've laid out. The recommendation that would come from, I guess, me, would be option 4. However, you do have 3 more options to look at, but I'll leave that to y'all to discuss if, you know, which option is good for you or not.
Excuse me.
Go ahead, Commissioner Barnes.
I like option 4.
You like option 4? Okay. Do y'all have any trouble with option 4?
No, I'm looking for it. Just give me
It's
just
the
a sec.
separate sheet,
Oh, yeah, that's actually the one I wanted.
the one you wanted.
Mayor?
Yes, Commissioner Friend?
Thank you, Mayor. Could you just remind us the deductible option 4
The deductible.
to the employees?
Yeah, the deductible for option 4 was that we would have the 5302 plan, which you have today, which would still be the low option plan, but we would change the drug card, okay? And then on the high option plan, we're going to raise the deductible from $500 to $2,500, okay? So $2,500. And the max out-of-pocket goes up from $3,000 to $6,350, but then we're going to use the healthcare reimbursement account to help offset that money, between that and the cost savings of the plan.
Does
Got it,
that,
thank you.
okay.
Okay, hearing none, I'm going to move on with option 4.
Okay.
Okay, the next item is the HRA. And this, I think that y'all might want to talk about a little bit, because we just threw together a scenario for you to look at. And Owen.
No problem.
Owen just mentioned the different deductibles. And you know, that's up to y'all to decide if you want to go higher than the example on page 20, which right now on the standard plan is calendar deductible is $5,000. Employees responsible for first 4. Employer pays the last 1,000. Currently, we do not do nothing with that plan. And then on 5773, we will be moving from a $500 deductible to a $2,500, and the employee will be responsible for the first $1,500, and we pay the last 1,000. Now that's the example. Now, if you want to pay more or less, you're welcome to do so. We have this in here as an example only. So, you know, I'll leave that to you. And how many employees we're building in for 20?
I think 20 would be a very, very, we'd be hard pressed to get 20 of them, to have 20 reimbursements.
Dan, I think you said something earlier, so I made a note about that.
Yeah, at a minimum, I'd like to at least see us split it. You know, if it's got a $5,000 deductible, I'd like to see the city pay for $2,500 with that deductible. And on the $2,500 deductible, I'd like to see us pay half of that, so $1,250.
So half of each plan.
Yeah, at a minimum. That way it reduces the maximum out-of-pocket expense for an employee down from $6,300 down to, what would that be, $4,100? Is that right?
Right about. And plus the cost savings that they'd save on the plans, they would be very close to where they are today. I mean, they're already at a max situation, even the way we have it set up here. If they hit the maximum out of pocket, they're going to spend the same amount of money they spent last year, okay? It would just be a better situation for them if you did that.
Like Commissioner Russell, you're saying half on both of those?
That's what I'd like to see.
Okay.
I mean, I'd love to see us pay 100% of it, but that's, you know, I don't think that's an option right now. Hopefully, next year when we get our new losses and we realize we're going to save money, hopefully we can readjust this and make it even better.
Exactly.
Okay. Rodney, did you hear all that?
Yes, sir, thank you.
Okay. Hearing no other decision, I guess we'll look at half of each deductible. You got that, Owen?
I do.
And what does that bring our cost to?
I would say that we double the 47,000 is basically what we just did.
Yeah.
So basically 90, let's call it $100,000 of healthcare reimbursement cost.
So
As-
we're
that
at
we would wanna
100,000 a
budget.
month,
No,
per month?
100,000 a year.
Year.
A year, okay.
That we
That's
would- if everybody used it. Okay.
If everybody used it.
Okay.
So I
just
think
one
we
particular
budget for
thing.
that, and then if you're under, you're under.
Okay.
Okay?
All right, the next thing is the group dental, from the staff standpoint, and also from a personal standpoint. I've had MetLife as well, and the.
I'm sorry to interrupt you. Yeah, just because she said that made me question. That money's paid by the city into an account. That money doesn't go to y'all, that stays in our coffers.
Yeah,
So it's not like,
basically
okay, I just want to make sure you knew that.
basically
Paid on an as-needed basis.
Yes.
So basically, the way we do that is that we'll have a form that the employees will use to submit it to us for reimbursement. And then we're going to reach out to you guys and have you fund that money, and we're going to cut them a check. Okay, so we'll come up with as far as the logistics of that, how the frequency of it, because if you paid it once a month, they have to wait for their money. If you pay it once a week, you get it quicker. There's not that many of them. I mean, just truly, because most people are using it for co-pays, deductibles, co-insurance, and then they're not because they're in charge of the first part of that deductible.
Sure.
It's much, and really, realistically, even though we're making the plan changes this year, we have to decide, you guys have to decide, because the plans will change on October the 1st, okay? So their healthcare reimbursement would run from October 1 to December 31, and then next year they would start again, is the way it would really look. So, okay?
Sorry,
No,
Okay.
I'm clear now.
All right, on the dental would be the next item. If we can leave everything the same, and same coverage, or we could go to MetLife, which, we would get the employees would get an extra $500 worth of coverage at no cost. So you go from $1,000 annual plan that they actually pay out of pocket to $1,500. So, you can get a little bit more dental work for that. So our recommendation would be going to MetLife for dental versus the Blue Cross.
I have no problems with that. I do have a question.
Okay.
As far as the dentists that participate in this, do we have enough dentists in this area?
We have very good coverage.
Okay.
For dentists in the area, so you should not have any issues.
Should not have any problems at all.
We didn't do a line by line, but we have other clients in the area that have MetLife dentists, and we're not having any complaints.
That answer it, sir?
Yes, sir.
Okay. Now, the next thing is vision. We do not offer that currently. I would like to recommend to you that you allow the employees, because I've had several come to me, would love to buy group vision insurance through the city because it'd be a lower rate. I would like to add that to our portfolio, and of course, they can buy it on an as-needed basis, and they would fund 100% of that.
I just have one question about the vision insurance. Do the other cities in the county offer vision as part of their package, or is it voluntary for them as well?
I would have to look, but just knowing several corporations and all, typically, they do not pay for vision. Typically, it is medical and dental, and, some other benefits.
I know the schools did not pay for it, but I was just curious.
I do not know that answer. I can find out.
Okay, I just don't want anybody to leave us for glasses.
Believe it or not, they would, right? You hope they don't.
The next thing to review is the group life insurance. Of course, the city pays 100% of this benefit for the employees. If we wanted to stay where it's at today, it's $25,000, or for an extra $640 something dollars. $638. You can increase the benefit to $50,000, so it doubles the employees' insurance from $25,000 to $50,000. And that'd be something that y'all can discuss. Either leave it the same or increase it.
Mayor,
Sure, go ahead, Commissioner Friend.
Thank you, Mayor. I would just entertain that we keep this part the same. This first year, we're taking on some as the city. I agree that the rate increase to 50,000 for the lot. If we have an opportunity not to add additional costs, it might be it.
Okay, so your thing is to leave it as is, correct, Rodney?
Yes, sir, just a...
Okay.
Anyone else on the board about the life insurance?
On that life, I just want to clarify
Yes,
something.
ma'am.
Okay.
You said 628 or 648?
Yes. It'd be the difference between the $1,012.50 and $1,650. So
And you're advocating that the city pay for that?
no, well, what I'm saying is, currently, the city has life insurance, and you have the option of leaving it the same,
Okay.
or we can increase. I don't, either way, I'm kind of leaving that to y'all. I'll be honest, my biggest hurdle with this was getting to the insurance part, medical insurance, because that's the biggest savings for the employees. And that's what we can do for them today.
Is that something that the city can afford to do?
We can
Just
afford.
to take it to 50,000?
We can afford it, yes, ma'am.
When I look at, it's only around $600 a month extra, and when I look at the kinds of expenses we have in the city on, sometimes what we would consider trivial things, I know we spend large amounts of money on paper and, that.
Oh, yes.
And we're talking about going to more technology and less paper. And if someone was lost, to us, through some tragedy, $25,000 is really a pittance to leave to a family to try to take care of, funerals and whatever. So, again, if we value our employees, we need to tell them so. And $600 a month, if the city can, you just said we can afford it, I say we go for that. So.
I would concur with that, too.
Okay. All right. Well, we'll recommend I'll roll that up into the motion that we increase it to $50,000. Do you hear that, Rodney?
Yes, that's fine. Thank you.
Okay. All right. I'd also like, and I want to roll all this up into, I'm sorry, not that, but also allow, and this would be at the employee's expense, if they want to purchase extra supplemental life, so if they want over the 50,000, or if they'd like to buy their spouse some insurance or some insurance on their children, we'll have that option. I'd like to recommend that we just allow them to do that, and that'd be part of the motion as far as the supplemental life insurance. I hear nothing on that.
I'm good with that.
Okay.
Okay.
I seen everybody's heads nodding, so that's the reason I said,
We're all good.
on page. All right, the next thing is long-term disability. Currently, the employee, you have your vacation and sick time. Currently, the employees does not have any long-term disability insurance other than what they purchased for themselves, or short-term disability. This long-term disability, as Owen alluded to earlier, would pay them 60% of their paycheck should they be out for an extended long period of time, which the benefits would start paying on the 91st day. So, you're talking about 3 months.
Is it retro pay?
It is not.
No.
And how long will it go?
It will pay till their normal Social Security retirement age, whatever that is.
And so would the
2865.
city actually keep them on the books? And I mean, if you have
Generally,
a
what would happen
30-year-old.
is that you would terminate their employment after they can no longer work. You can't keep paying them anyway. So you terminate their employment at that point in time, they would go on long-term disability insurance.
They'd go long-term, and they'd be taken care of to a certain extent. Today, there's nothing,
Right.
unless they pay.
Does the city do anything for them if they're determined to, do we as a
No, sir.
city? No? How many days about kill somebody? Just referring, I know 90 days without a paycheck would
Oh, yeah.
put a serious hurt on
But
somebody.
the good thing about long-term disability, when it picks up at the 91st day. So if they can rely on their sick time, vacation time, and this does include workers' comp, so anything that happens here, they're taken care of. But this happens if they're in a car wreck, something that's not their fault, but, they get where they can't work, the 91st day, they start receiving some kind of benefit. And that's totally up to y'all on that one.
Are you proposing, what are you proposing?
From a corporate standpoint, that's all I can tell you. I can tell you typically corporately it's taken care of.
And what's the cost of this?
It's $3,184 a month, correct?
That is correct.
Yes. It's a little higher.
That's right.
And we would only pay that on everyone?
That would cover everyone.
That's the total premium for the
That's
entire
a total
city.
premium for 155 employees.
I know the school district does not cover disability insurance. I know we could get that at a fairly inexpensive rate through a company. I don't know what the other cities or the county does about disability. I'd be interested to know.
Well, I'd like to just say this. I had an employee years back at Sally Mae who went in for a very simple surgery. He was 51 years old. He had 4 children and a wife, and he didn't come out of the surgery as he went in, and he was in a nursing home the rest of his life. He did pass, but he was there for a long time, and without that disability, family would have not been able to function. So I like the disability
You like the
idea.
disability? Russ?
I do too. I mean, I know it's 30,
So it would be a cost to the
39,000 a
city
year,
of
but-
about 39,000?
For those two, yes, ma'am.
Okay.
Rodney, you have any thoughts, sir?
No, I like it.
Okay, sir. Thank you.
Commissioner Barnes, any thoughts on the disability?
I'm good.
Okay.
The next thing is the critical illness and the the different accident policies. And this would also include things that the employees have with AFLAC currently on their own. Currently, they are paying individual rates. And the employees are welcome to continue doing that. However, if they enroll with ours, which will be with possibly the same carriers, correct me if I'm wrong.
They wouldn't be with Aflac, but they would.
Okay, they would pay group rates, which will reduce the amount extensively. This does not cost the city any extra money. This is just another added benefit to our portfolio.
I support that.
Okay. And lastly is the telemed. Anybody have, I don't think anybody, y'all kind of all spoke on that one. Okay, I think I got that.
You're good. At this point in time, would someone on the commission who's made careful notes care to roll that into a motion?
You want me to explain it?
No, I understand what we're talking
Okay.
about, but I have one more question.
Yes, ma'am.
Before I
Okay.
vote on anything. So basically, never mind. I'm going to hold that one. I'm going to hold it, yeah.
Mayor?
Good? Yes, go ahead.
I move that we accept the city manager's recommendation with all of the, what's the word I'm looking for? Benefits that have been presented to this commission.
I second it.
Okay, there's been a motion and a second. It was not very specific. Is everybody good with all the different?
Would you like me to repeat them?
Let's let our city manager just repeat everything. I mean, I think that Commissioner Barnes's motion is fine. I would just like to repeat it all one more time just to make sure we're all on the same page. Thank you.
No, when you listen.
It's not the original recommendation,
listening.
it's the revised recommendation based on the discussion we just had.
Yes. All right, that would include the city picking up the administrative costs for the FSA. That would include the medical benefits for option 4. That would include setting up the HRA for half of each deductible on each plan. That would include dental insurance with MetLife. That would include the city increasing the life insurance from $25,000 to $50,000. That would include the city adding telemed and picking up the cost for that. That would include the city picking up the cost for long-term disability for the employees at 100%. And then any ancillary such as vision, supplemental life, and any critical would be picked up by the employees at their cost. And however, they will have the ability to go through of interest to get those services.
That was my understanding of the motion. Was that everyone else's?
Yes.
Nick, are we good to go ahead?
And if I may, option 4 is a 95% coverage for the employees and a 60% coverage or payment for spouses and dependents, correct?
Correct, yes, sir.
All right.
On the low plan, right? And the high plan is the 80.
80, yeah, that's right, 80 and
And
60,
80.
80 and 60 in the high plan. The lower
Yep.
plan has a $5,000 deductible. A higher plan has a $2,500 deductible, for which our HRA is going to pay for half of those deductibles for each employee.
Right.
So the employee's deductibles is net $2,500 for the lower one and $1,250 for the upper one. Okay.
Okay, I think we're good. Mr. White, would you please call the roll?
Commissioner Barnes.
Aye.
Commissioner Russell.
Yes.
Commissioner Friend.
Yes.
Commissioner Tender.
Yes.
Mayor Anderson.
Yes, the motion stands approved, and the employees of Lynn Haven have a brand-new insurance. Thank you for that presentation. We look forward, to a long relationship with you, and
Thank you
we're
very much.
looking forward to working with you. At this time, we'll move to the last item on the agenda, which is public commentary. If anyone would like to talk about what we've just talked about, or if you have some new business you'd like to bring before the commission, this is your opportunity to speak. There appears to be none, so thank you all for attending, and we'll see you at the next meeting, which is Monday, September the 11th at 3:30. We began a long day. Okay, thank you so much. Meeting adjourned.